Me la paso con esta madre en Instagram, posting and pictures and trying to get attention and stuff. And you guys are probably like, the fuck is in that Stop and Bleed kid or whatever, man. But right now, we're gonna find out. Of course, we need a lot of more editing, equipment and shit. We was about to do the damn thing right here, man. First of all, the whole reason this kid started was when I started watching Stop the Bleed Kid. I had it up here, it was not there no more. With these tourniquets. And this is a cat tourniquet. As you can tell, it's a lot thicker, the windlass is stronger, and it actually just says cat right here. This one doesn't have nothing. This windlass is almost gonna break just by me applying pressure on it with my fingers. Imagine really twisting and having to stop somebody's blood flow with that. I kind of want to talk about the tourniquets, but I guess I'll leave that for another video. I have a little CPR. This is just a mask that you put over the patient's face so they can breathe for them. Along with the tourniquets, with the extremities, you're going to include bleeding. If you had to compress or apply pressure to maybe a bullet hole wound or a knife wound or a puncture wound of some sort, maybe some sort of steel rod, some construction site or something. So you just want to start stuffing this stuff in there, which in essence is supposed to soak it up and just kind of start clotting with the clotting agents, the blood itself. This is just some trauma shears in case you got to cut off the patient's clothes or whatever, the jeans. And then this is what's called a quick clot, hemostatic clotting agent that helps the bleeding stop. Same thing, you're gonna apply pressure for about 3 minutes or until the bleeding stops. And then you can either wrap it around, you can stuff it in there right behind the rotor gauze into the wound, just be packing in there, or just bandage it up, whatever you gotta do to make sure the bleeding stops. If the bleeding doesn't stop, of course, you have to continue applying pressure. Next we got from North American Rescue. I'm always tagging these people on Instagram. This is just an Israeli or emergency trauma dressing. The difference between this and a regular rotor gauze is this has kind of like a bowl-shaped thing in the middle, creating a convex shape towards the outside. So when you apply it against a wound or some sort of evisceration, emergency, whatever, you apply it on there and then you start wrapping it up so that bowl starts creating extra pressure. Got some tape, of course. This is what I tape this with. We have some emergency blanket for hypothermia, the triad whenever there is hemorrhage. Whenever there's bleeding, the body can't contain its own temperature. Of course, we want to keep them warm with this because that is life-threatening. Then we go to the airway. The airway at this point would be to mean secondary or third. First, we want to control the hemorrhaging. Make sure they don't get cold with the loss of blood. This goes into the nasopharyngeal. Of course, if you suspect head trauma, you're not going to insert it. And I think it preferably goes on the left. We have a chest seal for a thoracic wound or over here in the lung area, where the air might be going into the lungs or into the pleural space. That's the sac in between the lungs and the sac, which protects it from the rest of inside the ribs and inside your little thoracic area there. So it's going to be a chest seal twin pack. It's going to be the front and the back. What happens is you put it on the patient's chest, and then on one corner it's going to be there's going to be like a very little valve per se where the air might be able to come out if it needs to, but it's not going to go in, just out, so we don't create more pressure in there. And then last but not least, which would be kind of like fourth, unless you have some fluids or there's some med that you want to push because there's a secondary or underlying, maybe some seizures or something like that, pain, whatever. You want to get an IV. Usually for this, 18 or bigger. And then if the veins start collapsing because there is no volume inside the vascular system, then you might go with the 20. And then these are just some headlocks and a bolus, just in case somebody does have fluids. In my other box, which is here, we do have some fluids. But we're not gonna talk about that right now. This is just kind of like hemorrhaging, and pretty much that's it. I want to make a video since I'm always on this Instagram posting this stuff, and I know I'm not a good video maker, but I will be. So keep following me for more stuff.